deeply distressing and disturbing day here in Victoria, particularly for those families who have people in aged care facilities. What more telling indictment can there be, though, of the state of private aged care in Australia than the words of Daniel Andrews talking about his mum? I would not let my mum in some of these places. It has to be stressed that the vast bulk, all but 5 of the new cases involved in aged care facilities are in private aged care facilities, which are the ultimate responsibility of the Commonwealth. Very disturbing news too, on 2 fronts, both from the Prime Minister and from Daniel Andrews, that the authorities are quite clearly struggling to have the number of qualified health personnel that are needed to deal with this outbreak right across much of the aged care system in Melbourne. Also disturbing too that it does appear that some aged care facilities, private aged care facilities, have been suggesting to the authorities that they just simply haven't got the ability to cope, and that all their residents should be transferred over to the public health system. Well, that's not going to work. As Daniel Andrews says, he hasn't got 50,000 beds that could deal with that. 2 other points I'd make. This is a sector which has been in trouble now for 2 decades. The kerosene bars scandal of 2000, that's 20 years ago. It's not for nothing that we're having a Royal Commission into the private aged care sector as well. This is a problem that would have been there and would have been difficult to deal with without COVID. It's very close, you would have to say, to getting out of control as a consequence of what we are seeing now in Victoria with the pressures of COVID-19.